All right, welcome back, everybody, to the brain injury discussion. This is Jay, and this video, we're going to be talking about the possible links between traumatic brain injury and degenerative brain diseases. And that's what we are going to be discussing. And we're using scholarly research into this. And this seems to be one of the next forefronts of brain injury, where we are finding the link between the acquired brain injury, specifically the traumatic kind of brain injury, like the car accident, like getting knocked unconscious, to the degenerative brain diseases like Alzheimer's dementia. And that's what we are going to be talking about today. There's a lot to talk about. This is going to be kind of an interesting subject, and a lot of the information is fairly new. So, with that being said, we have a lot to cover, so let's get into it. Of course, like, subscribe, comment, sources in the description below. We'd encourage everyone to review the sources. So, before we start getting into the sourced information, we should take a look at the terminology. We have the acquired brain injury, which is what we work with as brain injury case managers. The brain injury case manager does not really work with degenerative. However, if they have a history of one of these things or an acquired brain injury, then they qualify for our services. So, what is an acquired brain injury? Well, if I could sum it up in as little words as possible, um, it is something that is not degenerative, not congenital. It is not something that was given to you via birth or genetics. It is something that happened to you in an otherwise perfect world would not have happened. And so this includes your cerebrovascular accident, which is a stroke, cancer, tumor, anoxia, carbon monoxide poisoning, and overdose. All of that would be on the non-traumatic side of these things. And again, acquired brain injury is either non-traumatic or traumatic. So um, those were some of the non-traumatic causes which could cause that cellular death within the brain. Now, traumatic is a little bit different. Traumatic is what we're mainly looking at today and seeing how that relates to degenerative brain diseases. We're talking about those motor vehicle accidents or MVAs, traumatic brain injuries, blast injuries, falls, penetrating and non-penetrating head trauma, and the list goes on and on and on. And we're going to be looking for the connection between this as a start point and this as the end point to degenerative diseases, which really do not fall under our purview under the current definition, which includes the definition of acquired brain injury says not degenerative, but they may have a history of a acquired brain injury. So, someone who has dementia, who's had a history of a car accident with a traumatic brain injury, does qualify for our services, but we are doing that based on the acquired brain injury, not the degenerative. So, um, we're looking for that connection though. And so degenerative brain diseases, like I said, Alzheimer's, Parkinson's, dementia, ALS, the list goes on and on. There's plenty of them out there. And I would also encourage people to look up these terms and to find out what exactly they mean, get a clear idea. Um, Words have meaning and they have very strong meanings, and knowing what you're talking about does matter. Maybe there'll be another episode where we talk about clinical terminology when it comes to the brain. Um, but we're looking at a lot of these terminologies and we're seeing a recurrent theme where, um, there's acquired and then there's other than acquired, where degenerative is not necessarily acquired. So, and that's what we're looking at today. Is there a link? Does one cause the other? And again, that should produce a very interesting discussion. Now, if you have a comment about TBIs, how they may have affected someone, um, obviously, I don't encourage putting personal information out there, but maybe there's something that you think might be a link there. I'd love to hear it in the comments section. So that gets some of our terminology out of the way. And let's get into this resource down here, this reference, which is 2022 Traumatic Brain Injury and the Risk of Neurodegenerative Disorder. Um, Again, 2022, that's fairly recent. And they found that traumatic brain injuries increase the risk for degenerative brain diseases. So, if you got hit in the head a few times in your past, that apparently increases the risk. But what they really noted, it wasn't necessarily the mild ones, but it was more of the moderate and severe traumatic brain injury with that loss of consciousness. And that loss of consciousness is probably the big takeaway here, as well as the moderate to severe. And that leads to probably most obvious the brain damage, but it really leads to axonal damage. Now, in this very low graphic image right here, we see the axon, which is the cellular level of what transmits information in the brain. And you got millions of these, many millions of these inside your brain, even as we speak right now. And any break in this does cause damage to the brain, and some theorize that this releases some proteins that are bad for the brain, especially and helps add to degeneration. So, obviously, is made up of many different parts, and we will cover that in a later time. But know that axonal damage does happen when you do have the traumatic brain injury, and I think that's something to be taken away. We don't want to hit the head. That's why I emphasize prevention um, and not just mitigation, because the best brain injury is one you don't have. I'd prefer to keep all these axons here healthy and well. But that is an interesting point to take away is that, yes, it is usually, they said, okay, it increases your risk, and it's usually the moderate to severe with that loss of consciousness. So when you see LOC in medical terminology, think loss of consciousness, which means that, okay, they're not responsive right now. So think about that kind of language. I'm not going to get into the severe, what kind of responses you might get, but think loss of consciousness after being hit in the head does increase your risk for dementia. So with that being said, let's continue on to the next slide and resource. So, traumatic brain injury and dementia findings. So, again, traumatic brain injury increased the risk of dementia. And this source down here, which is new, it's 2024. Dementia and traumatic brain injuries, the underestimated bidirectional disorder. They found that it increased the risk. Risk means likelihood, doesn't mean guarantee, but the risk by 70%. And that is a very high number. Um, and they point to it being trauma-induced neuroinflammation. Now, the brain is a soft organ inside of a very hard skull with bony ridges on the inside. And so any inflammation will cause the brain to put pressure on the brain within that confined space, especially against those bony ridges. So we don't want that. They noted that PTSD, post-traumatic stress disorder, from the TBI is quite common, but they noted that it was with the loss of consciousness, which implies that it was something greater than just a mild TBI or a concussion. So, and that's kind of the link, that's kind of the progression I'm seeing here. So let's take it logically. Your risk is increased because you had an incident where it induced neuroinflammation, which either could give you the traumatic, from the traumatic brain injury, might have led to some PTSD, and then um, it was noted with a loss of consciousness. Again, that's pretty severe. That's pretty important when it comes to brain injury world stuff, because when you lose consciousness, you have to that points to some serious injury right there. That being said, there's more to cover, so let's move on. So this leads me to that discussion we had a while back about multiple head trauma and how does this really correlate with the degenerative diseases as well? Um, we're talking today about degenerative via traumatic brain injury, so chronic traumatic encephalopathy or CTE, which again, the credit goes to the Concussion Legacy Foundation for really bringing this to the forefront of medicine, especially after injuries sustained by NFL players, specifically football players, and their brains were studied post-mortem, and they found that it is degenerative via traumatic cause. So CTE had multiple head trauma. It increased your risk for dementia or degeneration of the brain. Certain professions are at risk. So, yes, those football players who hit their heads many, many times, but the same could be said about hockey, same could be said about NASCAR drivers, same could be said about military. Again, my former profession, head injuries, any profession that really requires you to wear a helmet might be an indication that, it's something that could be dangerous to your brain. They found that the clinical features closely mirrored dementia. Closely mirrored, but maybe not exactly, but there might be some overlap there. And so we have this wonderful low resolution image here between a control brain, one with CTE, and one with Alzheimer's disease. Now, the control brain, I'd say that looks pretty good. That looks healthy. I believe this is SPECT scanning, but don't quote me on that. But this is definitely good imaging that really shows the health levels of the brain. And what we see with CTE is that is a very unhappy looking brain. So let's give it a sad face there because that's not happy. And then we have another brain here that is diagnosed with Alzheimer's, and we can see that there's damage there as well. And so this is another unhappy brain. And so what we're really seeing is that CTE, it is degenerative via the traumatic cause of the multiple head trauma. And this is why getting a good history on a patient matters to clinicians. You want to know what their profession is. You want to know what their past professions are, whether they were in the military or not, whether they were in sports, whether they were in contact sports. Did they wear a helmet when they were in sports? All that stuff really does matter, and we can see the difference where the multiple head trauma leads to the degeneration because of the profession, and it looks like dementia, but it might not actually be dementia. So again, there is difference, but there is some overlap there, and that's where it kind of gets into the weeds. And so, what does this lead me to conclude? Well, traumatic brain injury can be linked to dementia patients. In fact, if you have a dementia patient, they could have had a history of brain injuries. Now, it's not necessarily that they have to have a traumatic brain injury, but there may be an attributing factor between the traumatic brain injury attributing to the degeneration of the brain, which leads to a dementia or an Alzheimer's diagnosis. And these traumatic brain injuries are usually with a loss of consciousness. And we see that chronic traumatic encephalopathy is traumatic, which leads to degeneration. And again, dementia risks are increased via brain injury, specifically the traumatic brain injury with a loss of consciousness, which implies a moderate to severe level of brain injury. So that's things to keep in mind. And this is still fairly new in the medical space right now. They are still learning about these things. And so we saw a couple recent articles that really pointed to, yes, there seems to be this correlation between having traumatic brain injuries 20, 30, 40 years ago and the increased risk of contracting degenerative diseases like Alzheimer's and dementia, as well as many others. So those are things to keep in mind when you are hearing stories about someone getting dementia. Well, what was their profession like back in their day? What kind of jobs were they around? And were they hit on the head a lot? Um, Things to consider because there will always be new resources coming out. And I think there's something to be said about finding that link. And traumatic brain injury is probably one of the bigger attributing factors to dementia and Alzheimer's. So, with that being said, those are the resources. I'd encourage you to read them. They are definitely interesting, or at least interesting to me. And there's plenty of information out there. I'd encourage you to do your own research as well. Feel free to give us a thumbs up. We like those. Also, subscribe if you like this kind of information. And if you learned something new, or maybe there's a topic you want us to cover in the future, feel free to drop it in the comment section down below. We love hearing your feedback. That being said, I hope everyone has a wonderful day, and don't forget to protect your brains.